colleagues from our leadership team with me today, and I intend to let them introduce themselves when they come on the mic to maybe share some insider perspective. But let me just kind of provide some background on what we're doing and why we're doing it. We get feedback all the time that from one of the big things that Protiviti does is a lot of internal audit and regulatory compliance work at hundreds of healthcare organizations across the country, and in some of those scenarios we have a direct reporting relationship and responsibility to the audit and compliance committees of said organizations. And we oftentimes get requests, hey, can you organize a forum so that we may be able to interact just with our peers, just with other audit and compliance committee members, so and hear from Protiviti on what we should be challenging our compliance officers, our chief audit executives with. What get us up to speed with the things that they probably already know, so that we could be asking them good, meaningful questions. And we hope that this 90-minute agenda today. Last year we did it 60 minutes, but the collective group asked that we extend it to 90. And if we don't use all 90 minutes, that's okay. But asked if we could, host it again. And we intend to host it again next year, unless, of course, everyone doesn't find value in it. But the idea is just to provide you with what's happening in the industry, what's hot from an audit and compliance perspective, what are some of the studies showing. And we have a number of other agenda items. We have, as you probably would guess, if you are interested in CPE credit, you will be required to answer 6 polling questions throughout the discussion. They're very easy. They're not quizzes. They're very easy questions to answer. You'll see. If you're not interested in the CPE credit, there will be no requirement to answer the questions. But that is what we're required to do, as you can understand. So with that, I thought it would be great if we could start with introductions, at least of those that are not with Protiviti on the line. And I'm just going to use my screen to help me kind of go in some order here. But Jay, maybe you could start first.
Yeah, happy to do so. Thank you for inviting me, and thank you, Alex, for serving as our external internal audit team. And I'm pleased to do this because as a chair of both the Audit and Compliance Committee and the board, I often feel like we don't know what we don't know. At John Muir Health, which is a $2 billion healthcare system in the Bay Area. And I also am the vice chair of another hospital in the Bay Area that suffered through a cyber attack. So I'm acutely aware of some of the things that can happen.
Very good. Thank you, Jay. Appreciate you being here. Bill?
Good morning, Richard, or is it good afternoon, everybody? My name is Bill Chen. I'm the committee chair for Christus Health, the chair of the Audit and Compliance Committee. And I've worked with Richard as well as other associates of his. We have interacted for a number of years, getting a lot of support from Protiviti. And I'm looking forward to today's session to see if I could get some additional information and insight from other committee chairs, as well as the Protiviti members on this conference call.
Thank you, Bill. Hey, Randall, I think you're next on my screen.
Sure, I'm Randy Wright. I'm chair of the audit committee at MD Anderson Cancer Center. My background, I was a hospital administrator for 40 years plus, but I'm retired now. So even though I have a CPA, I never really worked in the industry in that regard. So Anderson's a little different in that we're part of the UT system. So our audit committee is under the oversight of the UT audit, but I think one of the things that really serves us well is President of MD Anderson, Dr. Pisters, takes an active interest in the overall role of the audit committee and gives us a lot of feedback, a lot of positive opportunities. And I do really appreciate the opportunity to have this forum with other committee chairs, because there are things that I have struggled with, particularly around just how to be effective in our use of very limited time. When we get together 4 times a year, and how do we make sure that we're providing asking the right questions, providing information back to the leadership, and being thoughtful in our approach. So I appreciate the opportunity to be with you today.
Very good. Thank you, Randy. We appreciate you joining as well. And to the point that you just raised, we have a prepared agenda, but we will move left or right as your questions dictate, and address what's most important to our guest today. Nancy, you're next on my screen, at least.
Good morning. I'm Nancy Horton. I'm a board member with Legacy Health Systems in Portland, or based in Portland, Oregon. We're a 7-hospital, roughly $3 billion system in Oregon and in Washington. I have chaired the Audit and Compliance Committee now for a little over a year, but have served on it for the 4 years I've been on the board. So our committee is grateful to Alex and Matt with Protiviti, as I'm sure many of you are with your Protiviti experts. We lean into them significantly to round out the compliance and audit functions. So I'm here generally today just to listen in and see what's new, and to learn a little bit about other health systems. Thank you.
Very good. Thank you. Holly, I see you up next.
Hello, everyone. I'm Holly Crawford. I'm the Audit and Compliance Committee Chair for SWHR, which is Southwestern Health Resources. It's a clinically integrated network, as well as it owns an insurance product called Care and Care. With this, SWHR is a joint venture between UT Southwestern, which is part of University of Texas, as well as Texas Health Resources. So my main job, this is my side gig, my main job is the EVP for Business Affairs for UT Southwestern Medical Center here in Dallas.
Thank you, Holly. Okay, did I miss anybody? I'm just trying to find on my screen. I think that is it. Okay. All right. So let's get moving with the agenda. And I did hear, one, Randy, I heard what you had to offer in terms of, question, and we'll make sure to bring that up throughout the discussion here for the committee. But the individuals you see on the screen here are the leaders that are going to participate in the discussion with me today from the Protiviti side. And then, obviously they'll interject throughout the discussion depending upon your questions. But you can see they're scattered all over the country as our leadership team is. Okay, next page. Our agenda, we've kind of grouped the discussion into 3 big categories. We thought we'd start with some healthcare industry challenges discussion. Probably nothing new to this group, but at least wanted you to see how others in other roundtables that we've conducted with healthcare executives and/or healthcare chief audit executives or healthcare compliance officers have rated the challenges for their particular organizations. And then we want to talk about a CAE, Chief Audit Executive Priorities study that we recently conducted and completed and unveiled at a National Healthcare Internal Auditors event just recently. And then last but not least, we are publishing a report here in the next few weeks. I believe January we'll be pushing this out, and from a healthcare report perspective, but we do an annual top risk study with the North Carolina State University ERM initiative, and that top risk study gets very specific into the industries that respond. So we're going to have a very industry focused paper, but we're going to give you a preview of the results. We already know the results, but we don't have the report published because the results just came in. So we want to show you what that looks like for purposes of encouraging discussion and you taking questions that you may have back to your own organizations. So with that, let's move on to the next page, and we're going to probably now transition to our first polling question.
All right, let me pull that up on the screen. Give me one moment.
And Kajal, who is going to coordinate our polling, is our healthcare marketing lead. So welcome, Kajal, and thank you for helping us out here.
Sure. So does everybody see this polling question on their screen?
Yes.
Great.
Yes.
So if you'd like to receive CPE, as Richard mentioned earlier, please select one of the choices that are there. How often does your audit and compliance committee meet? Annually, semi-annually, tri-annually, quarterly, or more frequently than quarterly? And once you've selected your answer there, please hit submit. Give you a few seconds to complete that.
And
I'm
how does
sorry,
it
I'm not
work?
clear on how to make my selection and submit.
Do you see
I see the
Bill,
question.
do you see the options like the little the round radio buttons?
No.
They're right. The answers that's like multiple choice, they're right under the question, Bill.
Oh,
It might have been a
Just click on
pop-up,
that little
Bill.
click on that little circle
oh.
for the one.
My screen seems to cut off.
Yeah, same with
Oh, I
mine.
see. Okay. Well, that's not a problem. What I can do is if you want to type your answer into the chat, I can collect that at the end of our session and we can record your responses that way. So if you want to just put in the chat for question 1, what your response is, that should work if you're having difficulty with accessing the poll.
Okay.
All right, great. Thank you. Is anybody else having a challenge with that?
Yeah, I am. I hope you just got my chat answer.
I think so. I think I just received it.
Yeah, and I'm in the
Yes,
same
okay.
boat. I did send the chat response also.
Perfect. Okay. All right, let's move on.
Yeah, and I think we can probably, I mean, obviously pretty easy question. We see a quarterly cycle is what we see most of the time for the audit and compliance committee meetings. But it's interesting. I did see one that was I'm not sure if that was annually meaning one, but there is an annual answer.
I think
Just
that was
perspective again.
mine, Richard. I was testing it. So shall we
Oh,
move on to the
okay,
next?
good.
Shall we move to the next
Yeah,
slide?
let's just keep going. Yeah. So
All
I think what
right.
we have to satisfy CPE. Okay, so let's transition into healthcare industry challenges as an agenda item. You can go ahead and go to the next page. So what we thought might be interesting to show you here. So as you know, in addition to having this forum with you, we also, in working with many across the industry, we also recently held a chief audit executive, chief compliance officer executive roundtable, and there were 35 or so different healthcare systems across the U.S. represented in this particular roundtable. And, you know, we put these 10 challenges. Well, you can see there are 3 mega trends across the top. No surprise to this group what those 3 mega trends are and what they mean. But you can see these 10 challenges or top of mind issues at the bottom. We had them sorted alphabetically and we asked them to rank those. For these 35 systems across the US, how would they rank? And we said, take off your audit executive, take off your compliance executive hat, and let's just have a discussion from a healthcare industry point of view, a healthcare executive point of view. What are top of mind issues, top challenges for your particular organization? And here's how they ranked out. You can see that, I don't, probably no surprise. I'm not going to read each to you, but as you peruse with workforce shortages coming number 1, we were a little surprised at third-party risk coming in at number 2 until we heard the discussion, and then we understood more about why they felt that was number 2. And then just recently we had another roundtable with another group of about 15 systems, different systems across the U.S. And number 6, which is margin optimization and care coordination, that had moved into the top 5 with that group. but 4 of the 5 that are in the top 5 were still there. So it's pretty consistent results across the board in terms of top 6. So any questions, comments about these?
Could you give some examples of third-party risk? Because I'm a little surprised that it's that high also.
Yeah. Alex, you want to start first?
Sure. And, when we think about third-party risk, it usually is thought of, or at least traditionally is thought in terms of kind of managing the security around those vendors that we use so often, be they IT service management vendors. They could even be vendors like ourselves that provide services to your organizations, but it's really kind of expanded beyond that. So it's moved into areas such as, legal, cybersecurity, information technology, procurement, compliance. I mean, it goes on down the list, and most notably, even supply chain. So beyond just the evaluation of the security around those respective departments, I mean, for example, your organizations likely submit a questionnaire to those vendors, having them fill out a number of things, providing a SOC 1 or a SOC 2 report that attests to, hey, we're doing all of these things to ensure that information is protected and that we use the appropriate platforms to access your information. But, lately, some of the breaches and things that have been happening that are either third or fourth party related have been things that can fall out of control out of those IT security assessments. So when we think of third party risk, think about those things that fall beyond just, hey, what about that security? What access do these people have to information within our organizations? But also, who's reviewing the contracts? Do they have the appropriate insurance? Because not everything goes through procurement process. Some things may have a direct relationship with legal. And we've seen this in other organizations where that contract is unfortunately really dependent upon that member of legal to be reviewing that, making sure the terms are correct, and that it gets updated, or if it's not an evergreen, that somebody approves the terms and conditions. So those types of things that fall outside of the realm of procurement, those can be risky. And we also think about, go ahead, Richard.
No, I thought you were done, Alex. Sorry, I was just going to add the 2 or 3 other things that we heard that group tell us, but keep going.
Yeah, well, I mean, the one last thing that I'll add about third-party risk is your organizations used group purchasing organizations. So you've got either the volume power of purchasing through a coordination with another health system, or you've probably even created one yourselves. Those can be used in their own system. They can be used in their own kind of contract management system. And internally at your health system, there may be another system that's using contract information as well. So when we pull information, where's the system of truth? How are we making decisions based off of information? So big efforts at health systems to try to ensure that where information is coming has been validated, it's agreed to, and that we can actually make some decisions based off that information. I mean, too many points of, hey, where does all this stuff reside and where are we pulling the info from? Hopefully that answers your question.
Yes, thank you.
Yeah, and let me just add 3 other things that we heard talked about when people rated third-party risk as high as they did. Some were thinking joint ventures. Some were thinking partnerships, similar to what Holly described a moment ago with regard to her role. They were thinking third parties in the sense of other organizations that that we have some sort of handshake with to do business together, whether it be a joint venture or partnership. And in those cases, it might be related to a performance issue, but a lot of times a brand and recognition, reputation issue, because sometimes those joint ventures aren't branded and sometimes they are, but when they are branded, they want to make sure that things are in good order, even if it's not the responsibility of the primary organization. And then lastly, the other thing that was mentioned, over the last few years, there's been a significant amount of resources that have been procured through third-party organizations. And oftentimes when you are procuring those resources through third parties, they're responsible for doing background checks. They're responsible for doing the exclusion screenings against the government debarred list. And we've heard of horror stories where a third-party vendor who was responsible for that didn't get it done. And therefore you went ahead and hired a person, and the person that you hired actually had warrants out for their arrest. So that's what they were thinking of when they were thinking about third-party risk, in addition to what Alex mentioned.
Thank you.
Yeah, and one last thing, Richard, I'll close out with this last thing. So you mentioned joint ventures and so forth. Many of you may be entering into clinically integrated networks, which have agreements with independent physicians, and those physicians aligned with the health system. There are a lot of questions from leaders about, where does that information reside? Who's got responsibility for it? How do we protect it? Who's got responsibility ultimately for setting up the security parameters? So again, another thing, when we're entering into a third party where our reputation is on the line and our performance is on the line, who's got the ultimate responsibility to ensure all those safeguards are in place?
And that actually moves us into our next
Well,
polling.
Conjure,
Oh, sorry, go ahead.
hold on.
Sorry, go ahead.
Yeah,
Richard.
let's make sure there are no other questions. On these 10, any other surprises, concern, or question about what's behind why they rated them the way they did? Okay, Kajal, now you can move us forward.
All right. So question number 2, this should be on your screen as well. Does your committee contain a technology savvy member? Yes, no, or unsure? So Bill, and I think Randy, if you are having trouble accessing this polling question, go ahead and put in your response in the chat.
Well, and if you're not comfortable putting the answer to that question in the chat, you can just email me separately. I forgot this question was in here like this.
Oh, I see it.
Do you see it? Okay, good.
I see it. It's great. It's perfect.
All right, I'll give everybody just a few seconds here to respond with the results. All right. It looks like it's 60-40. All right.
Okay.
Okay, I'm going to move on to the next slide. Go.
Okay. Let me do a check. Has anyone else joined the call that was not on when we did introductions?
Yeah, this is Ken Bernstein with Texas Health.
Hey, Ken. Hey, we're just moving right through the agenda. Would you like to introduce yourself to the group to let everyone know who you are?
Sure, make it quick. Sorry for any background noise. I'm in my car. My name is Ken Bernstein. I'm the Audit and Compliance Committee Chair for Texas Health Resources. It's around a $6 billion multi-hospital system in North Texas. I'm a retired partner with Ernst & Young, and I can answer the last question. We do have a tech-savvy person on our audit committee, and it's not me.
Very good. Thank you, Ken. And knowing that you participated in this roundtable last year, you kind of know what we're doing and what we're trying to accomplish with this. And there are a number of chairs from organizations across the U.S. here that have raised some good questions already and participating. So feel free to ask as we go along. We're just going to keep moving forward until someone raises their hand. Okay, with that, the next section, the second major section on our agenda. So we just talked about healthcare challenges from the point of view of from a healthcare executive point of view without the CAE hat on, without the internal audit leader hat on. Now what we want to do is talk about a study we recently completed. And this was considered, we do this in conjunction with the Association of Healthcare Internal Auditors Association. It's an annual study that we do, and we prepare very detailed write-ups. So if anyone on this call would like a very detailed report, I think it's like 50-something pages on what I'm about to show you, we can provide that to you. So go ahead and go to the next page, Kajal, and give everyone a chance to just peruse this. So many healthcare organizations across the U.S., I think it was close to 60 different healthcare systems. Their top internal audit leader reviewed or responded to the survey, and this was the results. These were the top 18 audit plan priorities as a result of that study, and we just unveiled this recently. So give you a chance to glance. And Ken, I know you're in the car and probably can't see it. You may have already seen this, but cybersecurity is number one on the list, for example. And when we say healthcare internal audit plan priorities, the way that how it gets ranked, if healthcare internal audit departments have these items, and there were like, I don't know, 60 or 70 different categories to choose from. This is just the top 18 we're showing you here. But these were the averages as to whether or not it was on their internal audit plans. So as you peruse, if you're like, okay, why is that a top priority across these 60 or so systems across the country, we can answer that question for you here. You know, why something ranked out so high. And Ken, if you need me to read aloud any, just let me know. Cyber was number one, for sure.
Yeah, Richard, don't interrupt the conversation that way. I'll figure it out as people talk about it.
Okay, very good.
So Richard, this is Holly. I guess I would be surprised at employee time and expense reporting and payroll, although I understand why it's a high priority from an audit perspective. It just seems like that's kind of like basic stuff, whereas, you know, cybersecurity is certainly a risk that is, you know, kind of enterprise wide, and you know something that's continuing to, I think, concern everyone. It just seems just quite a difference between cybersecurity and employee time and expense reporting. But I do understand why. I mean, that is a basic building block of an audit program.
Yeah, so we have a good answer for you on that. So let's talk about that. Similarly, we were kind of surprised that it would show up as number 2 as well. But with the additional context, it started to make more sense to us. And we responded similarly when you look at accounts payable at number 5 even. So let me tell you why. So there's a couple of things. And the first comment I'm going to make is going to sound critical, but it's not intended to be critical. This is just what we find, okay, and what others tell us. When internal audit departments that are fully insourced build their internal audit plans, they're largely building audit plans that align to the skills of the resources they have on their teams. Okay. And so those basic blocking and tackling, which you have to have, you can't ignore basic blocking and tackling because that's where some of the most basic fraud occurs. But that's why some of these items stay in the top 10 year after year after year. It's not because it's the greatest risk to the organization, but because it maps to the skills they have within their departments. Okay. And it sounds critical, but it's just a fact. Okay. Admitted by the IA community. The second reason, so for example, employee time, expense reporting, and payroll, and Jared, you can add to this too for us, but remember, we just came out of the heavy pandemic phase, and what we're finding is with all of these additional resources that we brought on board into our organizations, they're doing audits looking back to see if there was contractual compliance. And I can't tell you the number of audit departments that are finding that their organizations overpaid or paid inaccurately for nursing resources and or other administrative resources through the pandemic, just because it was a total nightmare at the time, and so nothing was accurate. And they're recouping material sums of money from those third parties, and that's coming through in this particular risk item. So there's actually an ROI on this one, even though it was kind of hard to see it on the surface. But Jared or team, anything else to add on that one as to why it's so high?
Yeah, and as Richard mentioned, clinical labor for both the employed and then what turned over to be the contractor side, both kind of fell in there. Obviously, as the pandemic hit, there was a lot of new COVID payroll codes being set up and how those were factored into the overtime calculations. And then just kind of, as Richard mentioned, the basic blocking and tackling of our payroll timekeeping system. Do they have any data discrepancies, or is there interfaces? Is there manual controls being done there? Because we do know during the pandemic, a lot of the manual controls may have gone by the wayside a little bit. And then the last thing was around, retention, referral, and sign-on bonuses. A lot of times we gave those out as incentives to get new individuals within the organization, but a lot of people did not go back and make sure that they were recouping those if the individuals left early or did not complete any of the contractual requirements from their contract. So those are the big pieces we were seeing there.
I would add, and you guys can correct me if I got this wrong, but it wasn't Workday hacked? And also in California, there was new legislation around break time, and there were class action suits, and we had to pay out a substantial sum to because we didn't document break times well enough.
Break time was an issue we were seeing within different states.
And you're correct. That's absolutely one of the drivers here. And I'll add too, many were going through new ERP implementations as well, where these processes were being revamped. And even though that is sitting there, you see it just a few down under HR, EHR, and ERP implementations, because they were spending so much time in this particular domain, that was another reason it came up to the surface. But good question, Holly.
Yeah, can I just follow on question? You mentioned that they're recouping money from the third party. So is this like for contract clinical labor, going back to those those agencies to with findings of incorrect billing?
Correct.
That is correct. Yes. Between the sign-on bonuses as well as the clinical contractors, yes. Making sure that you're only paying for time that was actually worked.
It's actually pretty simple audit, reconciling the timesheets.
Yeah. Thank you.
You're welcome. Any other questions on this particular page that
Yeah, actually,
well,
I'm wondering, where do you in what bucket would be coding for RAF scores and coding for modifiers and such on fee-for-service billing?
if much of that's going to be, well, for part of what you said, much of that's going to be in rev cycle compliance, revenue cycle compliance. For the, pure RAF scores from a payer point of view, in all candor, the volume of responses were heavily weighted to more of a provider point of view for these particular results. But if you just break down the payer only responses, that made the top 10 on its own. And in our paper, we comment on that. Specifically, if you just said, okay, from a health insurance or payer lens, that was a top 10 issue from that perspective alone. But from a clinical coding, clinical documentation, you'll see much of that come through in revenue cycle compliance, with a little bit into that next one, which is called charge capture, accuracy, completeness, timeliness, and reconciliation.
Okay.
And you can see also our conversation we just had on third party and outsourced services. They're in the number 7 categories. It was a tie. You can see that internal audit departments are focusing pretty heavily on that for their organization. See, it may not be auditing their primary organization, but their partners or whatever the relationships look like. But we've got themes. What we did was we took these 18 and we grouped them into themes. And I thought it might be helpful if we have someone just walk through each theme briefly without kind of draining it, just to walk through briefly, just in case it triggers another thought or a question that would be important to you, because this here is really valuable information for purposes of asking your CAEs. Okay, so do you have, I'm making this up, revenue cycle compliance on your radar? And if you do, what does it look like? And if you don't, why not? Because, we had so many systems across the country say it's a priority to them. But Matt, why don't you kick us off?
Yep. Hi, everyone. For those that I don't know, I'm Matt Jackson. I'm responsible for leading our internal audit and digital solutions for Protiviti for the healthcare industry. I'm just going to walk through on that first theme, that cybersecurity, physical security, and protecting sensitive information. Just real briefly on that one, obviously no surprise to this group. We've talked a lot about that one, but one of the important aspects from a cyber perspective, it's really easy to think about our cybersecurity teams and all the technical stuff they do, the firewalls, the pen testing, all that kind of stuff. But there's a big human aspect, a big people aspect of that cyber one that oftentimes gets overlooked. So a lot of, Richard talked about blocking and tackling earlier, a lot of those foundational practices are user provisioning processes. And number three, that user access management. There are still so many problems with making sure that people have the access that they need, making sure that access is removed in a timely manner, inclusive of those third-party vendors we've talked about. So many people have access to so many different things. Those user provisioning practices just really become a key component because a lot of times those attackers exploit our people. They use our people to gain access to the resources. So audit activity in that space, those foundational provisioning practices, user activity reviews, making sure that people are doing the things that they should be doing with their access, looking at our education and our training programs, how well we're keeping our people informed of their responsibilities in that space. Then stepping back, looking at it from an overall cyber perspective, are we trying to align with some kind of a framework like a NIST, high trust, et cetera? Are we aligned with the strategies of the organization? But just lastly on that theme, kind of the physical security aspect, really probably no surprise there as well, given all of the headlines and the things that we're seeing in that space. Really, it is an area of evolving risk as well. Making sure that our people are safe, making sure that our patients are safe. Again, education and awareness, making sure that our people know their responsibilities. Are we doing the appropriate testing and training in those areas? All those things really kind of factor in. So Rich, I'll kind of round out the first theme with that one. Any questions on those though?
Just a quick question. We spend a lot of time reviewing the organization's enterprise risk management program, and we really use that to drive our priorities. Is that pretty much a common practice across the industry?
That's a great question, Randy. In general, what we find across the industry is that the concept of true enterprise risk management is fairly immature and fairly lacking. A couple of years ago, the number one IA priority item on this page was ERM. And that's because organizations were trying to start the journey toward having an ERM function. And in the absence of having a group of resources or a department focused on it, they looked to internal audit to help get that process started. That's not the case anymore. Some across the country have actually started implementing more mature programs. It's a long journey. But in general, we just don't see it to be anywhere close as mature as we do in the financial services industry. But it is actually making its way in the right direction. It's just not there yet.
Thank you.
Richard, I can go on to another one of the themes if you want me to move on, unless there's any other questions on that one.
Yeah, go ahead and just do it briefly.
Yep. Yeah. So the next thing, just from an EHR, ERP perspective and data overall, just really that modernization, a couple of aspects, bringing our legacy infrastructure, our legacy systems up to par. We see continued efforts to enhance, install new EHRs, modernize legacy systems with new ERP systems. And then you get into that whole data realm. Obviously, we're a data-driven industry now. We can't just focus on what we see. A lot of times it's focused just on how can we use our data without looking at the how should we use that data and how are we allowed to use that data. So those latter aspects really become a big component of, and from an internal audit lens, just making sure that there's integrity in the data that we're using, there's ownership, and that we're using that data appropriately. That was pretty quick on those. Any questions on those two?
Yeah, was there no question what I thought, and we talked about third party already, Alex, so I don't think we probably need to cover that. But Caroline, could you comment on the revenue integrity and margin improvement aspects of this? What's everybody focused on there?
So definitely some of the pieces, Richard, you touched on, I think back to Jay's question, is definitely on the coding quality and making sure that we're coding appropriately for the right payment, but also looking at charge capture accuracy. So there's a lot of items, whether it be supplies, drugs, pharmaceuticals, ancillary type services. So once we have all of the items that we should, whether they're coded appropriately through the use of health information management, or it could be driven by technology. We're seeing a lot of dynamic use of the electronic health records. And so that creates another complexity as far as how we identify what we are going to capture, the process of which items are captured, reconciling them, making sure they're complete. So it's a lot of detail going into systems that sometimes honestly can feel like it has a bit of a black hole. So really getting that transparency into the data and making sure that we're getting things timely and accurately so you get the most payment that you can. What you're probably hearing too is a lot of kicking and screaming from your revenue cycle folks about denials. There's not a health system hospital out there, any provider that's not complaining about reduction in reimbursement and denials from the payers. So having more insight into your revenue cycle and your data and understanding, is it something that's of issue on the provider side, or is it something to take to the payers? We're seeing a bit increase there as far as looking at the performance of the payers and how they're paying the providers and seeing if there's opportunity for improvement. Any questions there or anything else the group wants to touch on?
Thanks, Caroline. I think the others are kind of self-explanatory. Layla, what I'm going to do, I'm going to tie yours into something that needs to be talked about on the next page. So if no questions here, we're going to move and pivot to, okay, remember this study, the survey was done 6 months ago, 7 months ago, and we just unveiled it recently. But things change rapidly in healthcare, as you know. So what was hot 6 months ago may not be as hot as what we're seeing in the last 30 days. So let's go to the next slide. This next slide just includes a number of bullets where we're like, okay, the tone and the response from the CAE community, the IA community tells us that these things are really, really hot right now. Like they became hot over the last 30 days when they may or may not have been hot 6 or 7 months ago, depending upon the organization. And there's reasons for that. And we'll just pick on a couple. But before I do, is there any one of these that is of particular interest you'd like us to start with in terms of adding commentary?
I would say artificial intelligence. I know it's top of the list there, but certainly hearing a lot about this. And I think there's a lot of confusion as to what this means, how easy it is to implement. I think everybody's like, oh, let's get this implemented. There's a cost savings, and is there really cost savings? And I'm sure there's a lot of security issues with it as well. So I'd be interested in that one.
Okay, Matt, you're back up. Holly, that was perfect segue because we expected that question because we're hearing it everywhere.
Yeah, and you hit some great points there. We are seeing, we are going to have a variety of interactions. You're going to hear a variety of things across our organizations. And one of the things, there's a lot of times that all the buzzwords in that space are used interchangeably. So you'll hear ChatGPT and AI used to mean one and the same from an overarching umbrella perspective, or natural language processing and machine learning and all of those different things, when in reality, they are very different. They have different subsets and different nuances and considerations for each. But really, all industries are dealing with this, and the implications for healthcare, as we know, just continue to grow as we look at the ethical aspects and we start to talk about the impact on patient care and safety and how those tools and technologies play into that. But in terms of focus, what we're seeing is coverage across really kind of the full spectrum, the decision-making processes that are being used to determine whether or not we should use those technologies and how we do provide that sufficient governance and oversight. We also see a focus on how to appropriately protect that sensitive information, because as those technologies start to access our information and start to use that information, How are we ensuring that they're using it appropriately? Like the people aspect we talked about earlier. We also talked about education and awareness earlier as one of the other ones. Education and awareness is key in this. A lot of times folks just think, oh, well, I can use it. I can go out and use it. There's some of the tools out there that I can just go access and use on the internet. Without having the appropriate policies and procedures and communication around that governance, we're seeing a lot of struggles in that regard as well. And just frankly, the impact on our people. People are worried about, are these technologies going to take my job? Am I going to become obsolete? The awareness overall and informing our people of what they mean to the organization and how that is going to impact their daily lives is important there as well. In healthcare, we don't see as much custom development, but when you start getting into custom development and ensuring that logic is sound and the development of something like AI becomes exponentially more important, because it's not something that's just simple testing and you can say, yep, looks good. It's ensuring the algorithm and the logic is appropriate becomes really, really, really important. And then one other aspect, one other twist to this, I'll kind of wrap out the AI piece, is not just how our organizations are using these tools, but how does our internal audit function? How is our internal audit function using these tools and technologies? Are our auditors using ChatGPT to write their audit reports? Are we aware of that? Are they developing audit procedures using those kind of tools? Are they using ChatGPT to compare one risk compared to the other, which is more important to our organization? And then just really looking at people unknowingly using those tools and exposing our organizations to risk is becoming a big factor. So some organizations are saying all stop, some are saying proceed with caution. What we're seeing is a bunch of silos pop up where we find out after it's implemented that it's already in place. Holly, did I help with any of your questions that I didn't address there?
And, I'm curious because there's a lot of frustration right now with payers denying claims and the cost of following up on small dollar claims that have been denied. And one group of people who are being funded by VCs came to me and said, do you think that this is a area where AI could be useful in resubmitting claims without having to have a lot of people intervening? And I said, you need to go talk to people in the Epic user group more than anybody else. But have you seen that at all, using AI in claim submission?
I can take that. We are seeing it in claims. Yeah, we are seeing that in claim submission. I would say on the denial side, we're also seeing, and this is something we're looking at as well, is understanding where the denials are coming from in the first place, right? So being able to identify and even predict denials before they happen. There's a lot around that piece that's happening in the industry as well as internally for us. So that's an area that we're hearing a lot of buzz around. Automation can help with the claim submission. A lot of times it's gathering information. So there could be additional data requests coming from the payer. So bringing together medical necessity documentation that could be pulled from Epic Index, pulled together. So that's an automation capability to be able to submit that information. So it could be an attended, if you've heard of an attended bot, it could be, a complete bot. When you get into automation, there's different levels, but definitely a huge opportunity there.
And the other one aspect of that, sorry, Layla, just as some level setting. I know this topic is artificial intelligence, but some of those other emerging technologies, we talked about automation, we're using artificial intelligence to essentially take robotic process automation and make it intelligent. AI touches on so many different emerging technologies. I do want to make sure that that really is encompassing a lot of different areas. Sorry, Layla, I know you're trying to jump in there.
No, that's okay. I was just going to help finish Caroline's thought too around coding, in that we are hearing organizations that are looking to, instead of having coders who are taking assessing the documentation, looking at it from an accuracy perspective, is they're using AI to automate that. So I do think that's the future. I think it's very risky and too new now, because you obviously could be submitting claims that aren't coded accurately, and then there's potential fraud and all of those things. But I do think it's something that we're going to see more and more as it gets just the process and AI gets smarter.
And that last part is a good one because the difference between traditional artificial intelligence, where it's just simulating human activities, to true generative AI, where it is learning based on the data available to it. It is learning based on interactions. It is learning. That aspect does really compound the need for the right decisions, the right oversight over these activities once we start getting into that realm.
And Jay, I would just add one last thing regarding that is, you know, the payers are getting kind of wise to all these things as well. You know, there's some strategy in making sure that your processes for submitting claims aren't all that efficient, because then that just means that they have to pay you quicker. Sometimes they build into their contracts, you know, the prohibition of any AI, any automation into your claim submission process, which requires you to go outside that. They're not all like that, but I see that when there's something that we tend to get better at on the provider side, the payers tend to find a way to, I don't want to say combat it, but find ways of either holding claims, increasing denials. There's always some little cat and mouse that goes on, but we've got a risk assessment presentation upcoming through y'all at Mira where we may be able to get into some of that.
Okay, thank you.
Yeah, and I'm sure the group has seen in the news, but there are some class action lawsuits that are bubbling and beginning to take hold with regard to payers like United Healthcare and others. No judgment here, it's just what's in the news, right? That they are using AI in an unethical or wrongful manner to deny claims. And an example is where AI is trying to derive a similar judgment that, hold on, I'm going to let Linda in here, but AI is being used to derive a judgment or subjective decision on medical necessity determinations when a physician has already made the determination based upon the facts and circumstances of the scenario. And so those class action lawsuits are only going to build and grow. So the organization's using them in a big, meaningful way. Better hope that they can defend them as well, because they'll find a way to find weaknesses in that application. Linda, it looks like you were able to join us here. Would you maybe like to introduce yourself to the group and tell them about your AC chair role, etc.?
Oh, certainly. You can hear me, right?
Yes, ma'am.
Linda Vitlisell. I am on the board for Integris Health in Oklahoma City, and I look after the Audit and Compliance Committee there. Have done that for about 3 years now. And our remit is both compliance and audit. Yeah. Thank you.
Thank you, Linda. You've got a number of other chairs on the line here from across the country, and you know, we're just making our way through the agenda. But if you have questions along the way, just you know, let us know.
Brilliant. Thank you.
You're welcome. Okay, so anything else on this page? I thought maybe while you're still perusing the list, so we talked about the IA priorities that came from the study, but over the last 30, 45 days, these items have kind of come to the surface in a pretty material way that we see internal audit departments shifting their focus around. What's on the page here. But Layla, maybe you could comment on compliance just for a bit.
Sure, happy to. What I would say is, and I know anything I say regarding this is not going to be a surprise, but we are predicting and we are seeing a real steady increase in enforcement, especially as it relates to pricing, payment related requirements, No Surprises Act, price transparency, drug pricing. If you look at the 2024 approved federal budget, there's anywhere between a 15 to 20% increase for enforcement purposes across many agencies that compliance tends to very much care about. We're also starting to see a lot more cross-agency collaboration, especially as data analytics, AI, it becomes much more sophisticated. The government's getting really smart at looking at data and what it means. So it's just putting a lot more clout around enforcement, since many different jurisdictions and agencies are working together. And this past summer, actually, there was a very huge settlement of 2.5 billion regarding fraud and opioid abuse schemes that the Justice Department brought down about 80 individuals. So I think we're going to see more and more of this. And I think what we're seeing is many organizations are just frankly keeping up. The challenge is just keeping up with so much of the complexities and compliance with different requirements and its impact to fraud, waste, and abuse. And so, what I'd recommend is that, this all really kind of, if you look at it from just a high level perspective, it's really focuses a lot on compliance program effectiveness. And that's definitely an area that we would recommend internal audit actually do, is perform compliance program effectiveness reviews. The other thing to make note of is just last month, the OIG released a very good document, albeit 90 pages, but it's a pretty easy read. And it really talks about, for a compliance program to be effective, here are the key things that you need to do. Here are the 7 elements. It expounds on them. It talks about a board's responsibility. We can send that out after the meeting, but I highly recommend this group, if you can, just peruse it, just so you're much more informed. So I would say that's an area that internal audit could help with, and also around just scope of coverage, making sure that compliance is really, do they have the eye on the ball? Are they looking at the right things? Because you can't boil the ocean, so you got to figure out what it is you're going to look at.
Layla, I'm just going to ask a question for the group of committee chairs here, but are there any 1 or 2 major differences in this most recent guidance published that would be good to put top of mind for the group's back pocket?
Yeah, I don't know if I would say differences per se, but they've been much more clearer that the compliance officer should not report to legal counsel in any capacity. It does make it clear that the compliance officer should be at a very senior level, the same, I should say, as the general counsel, CFO, and that the compliance officer should be reporting up through the board. So governance is a very big focus area within that program document.
Thank you, Layla. Any questions for Layla?
Question, Leila, this is Linda. So that last statement that you made about reporting of the chief compliance officer, what are the implications to an organization if they do still use that direct hardline reporting to general counsel? That's part A. And part B is there a distinction that could be made for reporting administratively as opposed to reporting for responsibility?
Yeah, I would say, so for the first one, the implications would be that if you were to get audited by the government, or if there was a overpayment or false claim and you needed to self-disclose, the government, could potentially put you under a corporate integrity agreement. That corporate integrity agreement would require you to have that function not reporting to legal counsel. So it's really more from an enforcement perspective, but the idea is the government would say your program wouldn't be considered effective if you have that reporting relationship. We do, now that said, we do still see many organizations who, one of 2 things, they report up through legal, or the general counsel and the compliance officer are the same individual. So we're still seeing that today, despite the guidance. I do think that will change over time, because the last time that this guidance was provided was in the late 90s, early 2000, and the compliance community has been waiting for this for 20 years. So I think the government is going to use this more and more as leverage if there are issues that pop up, or if you have whistleblowers and things are disclosed to the government, they're going to continue to use this as leverage, saying, hey, organization, you should have known this. We've told you this and you still haven't done it.
So administrative reporting versus responsibility reporting, is that a distinction without a difference in their mind?
They don't distinguish that. We do still
Okay.
see that. They're not explicit in saying that. I think the spirit and the intent of it is that the compliance officer is independent and objective on, what they're able to do and who they're able to go to is, I think, what the real intent is. Administratively, usually it's, one could argue administratively, if general counsel is providing your annual review, to me, that would be of concern. To me, should be the CEO or the board or somebody else other than the general counsel who has a say in your performance. So I think it depends on what we mean by administrative per se.
Thank you.
And to clarify though, the guidance by doing it by continuing the reporting through the GC's office does not mean that you are going to be cited for being non-compliant with a rule or law or reg. That's guidance to help you demonstrate an effective compliance program should you fall into a non-compliant scenario in another category that could support your cause. But Linda, I wanted to be clear that Layla, there's nothing in the current in this recent guidance that says
It's guidance.
yeah, they didn't create a new law with it, basically.
Right.
Yeah, okay.
So organizations that just have to assess the risk that they're willing to take.
That's right.
Yeah.
So Richard, would you say this is akin to the external the external financial auditor typically reports directly to the board as opposed to the CFO?
Yeah, it's all in a similar, second line of defense, compliance, audit, external audit, as you're referring to. It's in a similar vein for purposes of trying to create more independence and objectivity in the process. Yeah.
Gotcha.
And I don't mind admitting, we've seen firsthand, either while we're playing the role of compliance or we're doing these compliance program effectiveness evaluations or just doing internal audit or some other special consulting project, we've seen some organizations, because of the reporting, not necessarily always do the right thing. So when you kind of assess the risk, you're assessing the people in the roles to determine if you believe the compliance officer would be brave and courageous enough to raise a concern or an issue to the audit and compliance committee, even confidentially, if they felt like they were being asked to suppress something. That should go into that evaluation of risk for whether it's appropriate or not. But we have seen some organizations do the wrong thing, and if it got exposed, they'd get penalized for it. But for the most part, everybody's trying to do the right thing. And if it's the right legal counsel and it's the right compliance officer, you frankly can have a really great outcome as a result. Okay, looking back here at the list, anything else jump out as something you'd like us to comment on? We're prepared to speak to each as to why something would be on the hot list.
I'm just intrigued with the HRSA audits being something that's popped up in the last 6 months. Is there something specific that's happened there in the short term?
Yeah, Alex?
Yeah, so I just think given that there have been those provider relief fund attestation periods, we're getting close to those periods, coming to an end of when the reporting needs to happen. But some of this is cycled on the basis of when those single audits are done by the external auditors, and when they have findings that come from those, they're a little bit in arrears, so they're still kind of top of mind. But in addition to the provider relief fund reviews that are taking place, HRSA is also looking at the balance billing that might be taking place, and also billing for people that were otherwise may have been eligible for other forms of insurance. So the OIG did a probe audit that identified that close to half of what they reviewed in a sample of patients that received that organizations received HRSA funds for seeing should have been identified as those that had other forms of insurance. And so OIG makes a recommendation to HRSA that, hey, we see opportunity for close to $500 million out on the table for potential recoupment. Those letters are going out to organizations. Some have already received them. Some are going through some pretty detailed reviews. And it's a big ask. They're really asking to go back through a lot of information for a health system to review and to look at all that's been submitted to HRSA. So it's kind of a combination of a lot of things. It's not just the single audits, but it's also looking who should not have received the HRSA funding and going back and making those adjustments. So those things will always remain top of mind when it has a recoupment element associated with it.
Thank you.
Yeah, and Alex, just the reason it's showing up in a lot of places, they're getting audit requests, right? I mean, that and the
100%,
amount
yeah.
of time it's taking organization. How many received the request to our knowledge? It was a number.
I mean, I have to go back and look. I know that from our own clients, I'm aware of at least 3 that have gotten those letters and requests. But I don't know the full numbers that have been, if there are any published by HRSA, about who's received the requests.
And
But
that
you can
and
add
that,
you can add FEMA to that too. So, not just HRSA, but FEMA coming back and asking for more information about what's been filed on a FEMA expense purpose. So any funds that have been accessed that have been federal, the government is knocking and asking for more information about whether those things were accurate.
and knowing what the request looks like, Randy, it is exhausting the amount of information they're asking for organizations to prove that funding they receive should be kept. It's exhaustive. I mean, taking lots of time for the organization to respond. And we're just guessing they're going to replicate that across any system they think they can get money back from. That's why auditors are picking up on this and doing some pre-work, or when the audit requests come in, they're starting to actually participate in the response process.
Yeah, and not only the requests a little bit over the top, but the timelines for supplying that information are really aggressive. I mean, asking for a ton of information in a very short time frame.
Thank you.
You're welcome. Anything else here? Okay, we'll just move us forward, making great progress. Okay, this slide here we included only because this was something that we get this question all the time from chief audit executives across the country, and that is, what do you see other organizations, internal audit departments do that keep them in a strategic or highly valued place for the organization? And so what we've been sharing is this list of bullets that we see many do, but we wanted to give you an opportunity to review it to see if you had something else that you see your internal audit departments do that we could add to the list, that help them stay very value added, ROI mindset, strategic to the business. And you can see there the question on ERM earlier, they bring ERM program perspective just to help organizations think about things more holistically and to start that pure ERM journey. But I'm just going to pause and give you a chance to glance through the list. And we're doing the last one on this page now. And some of you are here because your audit committee or your chief audit executives invited you into the discussion. So I know that we've heard from you all many times that is helpful and appreciated. Anything jump off as missing, or wondering what in the world it means?
I'm sorry, I muted. I'm not sure if it's missing or not, but a huge success factor in our internal audit function in terms of follow through and action plans is CEO support.
Got it. Yeah, that tone at the top.
Richard,
Sure
this is Bill Chen. I just have a comment about the whole business around IA that's keeps popping up. My biggest concern is that there's a lack of consistency in what different individual understand IA to be. Sometimes even just data analytics of big data is considered AI when it's really been done for quite a while now already. And things like, adaptive approaches to reacting to data analytics, for example, can be considered AI when it may not really be. So I think perhaps a distinctive line that could be drawn between what is really just adaptive analytics versus true AI. I think there needs to be some clarification on that.
Okay, got it. Got it. Yeah, and by adding the clarification and talking more about it, it can certainly help to raise the internal audit stock for purposes of helping to guide and direct some conversation around that for the organization. Sure. Okay.
Thank you.
You're welcome. Okay, so we still have a handful of things to kind of get through here, but everything's going to speed up at this point. Okay. But we wanted you to kind of see and hear some of the questions and answers that we've seen to other things. But the next thing we have to get through is polling question number 3. And so, Linda, we had talked about if someone needs CPE credit, they need to respond to the polling questions. You have difficulty doing so on the screen. You can provide the answers in chat, or you can email them to me, whatever you need to do. But we've got polling question number 3 up.
Yes, it's up on your screen. Does internal audit and or compliance provide training to the committee? Yes, internal audit. Yes, compliance. Yes, both do, or no. And again, if you have trouble accessing it, please put your response in the chat box. Give you all a few minutes to complete that.
What about adding a response that's yes, both, but not enough?
Note taken.
Just to clarify this, I'm the one who put the internal audit only. Compliance is a separate activity with our structure. So we basically focus on the audit side, and compliance goes a different path.
And I certainly feel comfortable telling this group this in this setting, but the agendas put together for the Audit and Compliance Committee meetings are managed by a function that is independent to Audit and Compliance, and they are very, very particular about the agendas and the time spent on certain things. But I would encourage you, if there's more training appreciated and desired, just mandate it, because they're thinking that they're trying to keep the agendas tight for you, but maybe they're not hitting the mark.
I think the training could also be done in a way that doesn't take up a lot of committee meeting times. In that there could be just an ongoing handout, educational handout at the outset of every committee meeting, sort of like a homework, if you will, but done on your own time.
I agree.
Just a thought.
Just a question for the group. We have started having twice a year educational sessions for the committee. And that's basically outside the normal committee meeting process, and it's helped a great deal. So we had the Chief Information Officer do a presentation on artificial intelligence here about a month ago. So those things have helped. They are obviously optional, but the ability to not take time away from the actual audit committee meeting function and focus on sort of the continuing education process seems to have given us a little more flexibility than what we had before.
Very good. Okay, let's move us on. Okay, what it's going to feel like a speed round here. But these were questions that we asked that CAE group, those 35 healthcare systems represented across the country, just so you can see their answers. You don't have to provide answers now. There's 3 more questions coming later. But we asked, what areas other than IA does your committee have responsibility for? And, you know, more than half also have responsibility for compliance, and then 22% have responsibility for ERM, but that's low because not everybody has ERM. So just FYI. And then there's a handful that have internal control, and you see that usually more in those companies that are public that are required to have Sarbanes-Oxley programs. Okay. Next page, let's do this quick and just to show you some of these answers, and then we're going to pause just for out loud discussion. But what other committees beyond the Audit and Compliance Committee does IA advise, report to, or collaborate with? And you can see that almost a third report to the Finance Committee or the full board separately. That was kind of interesting to us. We hadn't really seen that many places. IA typically just reports to the Audit Committee, and that's it. But about a third tend to also report to a Finance Committee. Okay, next. Do you have a formal ESG program? And 85% of those in the room, no surprise, said no. That's just because ESG is, even though nonprofit healthcare and healthcare in general, through community benefit and other things that they have responsibility for, they're doing some things that would qualify, but in general don't yet have a formal ESG program because it's not regulated or required just yet. Next page. Here's to go to the question. Does your organization have a formal ERM program? 77% of these 35 systems said yes. That's these 35 systems, and they're pretty well known, highly regarded, high reputation systems. So I'd expect that number to be bigger there, but across the board, it's probably less than 50. But this group, it was 77. Okay, next page. All right, how many days a week do you require your IA staff to come into the office? And this was a very heated debate in this group of 35, and not among each other, but they were venting about how they debate with their own leadership teams within their own organizations. But, you know, almost 70%, 69% are all fully remote. And then most of the rest are only coming in a day a week. We're finding that to be true for most audit and compliance functions across the US. Most.
Does that include, is fully remote, where someone would place outsource?
Well, yes, but in this case, these were all in-source organizations that answered this question. Now, many will co-source, and we even ask, okay, so how big of a deal is it for people that you co-source with, like say Protiviti, not outsourced, but just co-sourced, you know, where we do a handful of projects a year for them, that we be present on site? And they're like, well, if you come on site, you're not gonna see anybody because we're at home. Like, okay. Just let us know when you need us there, you know, that kind of thing. But it certainly is a huge shift in how we operate. Okay, next page. And you're going to get this deck, by the way.
We've got the next polling question, Richard.
Yep, go ahead.
All right, there you go. Would you like this roundtable to include your CAEs or remain as chairs only? Include CAEs, have chairs only.
Yeah, so this meeting that we do next time, keep it to chairs only or include your CAEs?
This is the first time I haven't seen the question.
Oh, here, let's see. Do you see it now, Holly?
I do not.
It is a pop-up. It might be behind another screen.
Yeah, if you are having trouble seeing it, just put your response in the chat.
Okay. Yeah, it's the first time I haven't seen it.
Huh.
Which is weird. Okay.
Yeah, I had to scroll down in chat to get it.
Richard, let me know when you would like me to go to the next slide.
Yeah, I think we can go to the next slide.
Okay.
And I want to get us through the polling questions because that's important, but at the same time, so we're going to do this fast, but you'll get the slides, everyone. And I want to give a few minutes to just kind of ask other open-ended questions that haven't been asked yet. But you can see administrative reporting. Who does IA tend to report to most of the time from an administrative perspective? Most of the CFO. Kajal, you can keep going.
All right.
Risk assessment frequently, your internal audit teams are doing risk assessments and oftentimes with compliance combined, and most are doing annual, and then some are doing, more frequently than annual. It has to be revisited more than once a year, in our opinion, but that at least is kind of where the core is. Next page. I'll let you study this when you get the slides, but this is some benchmarking on how much is spent on internal audit based upon the size of your organization, just from these group of 35 systems, okay? I'm sorry, no, this came from the IA priority study, right, Jared? So this was a lot larger than that. This was a larger group of nearly 60 systems, if I recall.
That's
Or
correct,
this
yes,
might
sir.
have been, okay. Next page. And then IA departments, when they say, okay, let me show you how we divide our budget up, they spend most of their time on operational audits and then the next highest percentage of time on IT audits. So remember that IT audit. So next page, yeah. So then where do they prioritize their time with co-source partners? Like where do they seek help from the outside most of the time on IT audits because they lack the IT skills in their departments to do those audits themselves. And then coding audits and rev cycle audits are number 2 and 3 with compliance coming in behind that. Okay, just fast forward on to the next polling question. Just get that behind us here because these will be good. There you go. No. Okay. There's a question up, Kajal, right? That says, how often would you like us to host this chair roundtable? It's either annually, semi-annually, or more frequently than 2 times a year. Right now, we're doing it annually. That assumes you think that it's valuable to hear this kind of material.
If you aren't able to access that poll, please put your response in the chat.
Okay, it's looking like maybe twice a year kind of has the. Okay. All right, next one, Kajal. Oh yeah, okay. So I do want to show the group this, and you'll get it. But that top risk study that I mentioned that we're getting ready to publish a report on in January, this was from the perspective of top executives and board members across the globe who answered. So go to the next page. You can see here that here are the top 5, and then we have risk 6 through 10 on the next page. But these were their concerns. Don't stay on the 1 through 5, please. These were their top concerns for 2024 in terms of risks to their organizations. And the very most hot off the press, this is an advanced preview, but increases in labor costs is number 1. Economic conditions, including inflationary pressures, number 2. And those, you can see the year-over-year trend on both of those has increased where they stood last year. We've been doing this for more than 10 years, this particular study. And still number 3 is ability to attract, develop, and retain top talent, but the concern for that has trended down compared to last year. And then Layla's comments about regulatory changes and scrutiny came in at number 4 over last year, and then cyber is number 5, and then the trend increased over last year. So the next page, Layla, and we're going to provide you with a very good write-up on that. There's third-party risk again, privacy, legacy IT, digital tech, and then changes in the current interest rate environment. Okay, Kajal, I know we're kind of scanning through this list fast, but it's just a quick preview so you can see where the industry is at the moment. Next page.
We've got our final polling question, so I'll throw that up on the screen.
Yeah, there you go.
What would you like your organization, CAE, or this training to provide better information on? Cybersecurity, supply chain, compliance, data and analytics, or AI?
I've got a pretty good guess. Okay, that really concludes the materials here, and thank you for doing the polling and getting the CPE credit you needed. But were there any other open-ended questions that the group wanted to get out? I know, Randy, you had asked about early in the agenda about how do you manage time effectively in the short amount of time given for those committee meetings, with the information that's being provided. I don't know if that's still top of mind after everything we discussed, or if you'd like to move on to another question, but I'll pause for the group.
This is Nancy Horton. Thanks for the great presentation. It's helpful. I'm wondering if Protiviti has a way or is tracking any health systems that have gone through or may be going through consolidations, mergers, different things, and is there any information on the backside of that extensive process that could be shared to this chair's group of things to look out for, ahead of time?
The answer is yes and yes. And so much of it comes from lessons learned in the due diligence process, where
Right.
sometimes you get burned and sometimes you don't. But yeah, so what we'll do is we'll put some talking points together and share that via email. Is that okay?
Sure, yeah. And I'm just thinking, like, of all the topics that you've covered, but put a little twist on it, right? To say, hey, this is what surfaced. This was a surprise that it surfaced, or maybe this didn't. It's the same topics that you guys cover so well, but just in that specialized environment. Thank you.
You're welcome. But I'll tell you one thing right now that tends to always kind of be a surprise, even though it's basic, and that is if a consolidation, acquisition, merger, whatever it is, if you're taking on and assuming the AR balances for that organization that are historic in nature versus a cutoff, you're assuming the compliance risk with that environment too. And it's always a surprise when the government shows up. They're looking at claims that were audited from periods before you owned, but you have responsibility in the after the acquisition if you took responsibility for those accounts. So that's always seems to be a surprise that ends up kind of rearing its head. So doing some real good heavy due diligence on that prior AR file is important.
Yeah. Great, thank you. The lawyers always cover that well as indemnifications and such, but yeah, I would think Protiviti would have a unique perch on that, and I'd appreciate it. Thanks.
Yeah.
Yeah, unfortunately, it's a long list of about 80 items.
There's a lot. And Nancy, we've got an upcoming risk assessment discussion, and I'll make sure we're prepared to go over that and have it ready for you as part to help guide the conversation.
Okay, looks like we're at time. I know you're all busy, but I'm happy to stay on if anyone else has questions. Otherwise, thank you so much for your time today. Hope you found it valuable.
Yep. Thank you, Richard.
Thank you, Richard.
Thank you.
Appreciate it.
Thanks, everybody.
Thanks, everyone.
Thanks, everybody. We'll
Nice
email
to meet you.
materials along.
Have a good day.
Thank you.